Well, you've no doubt by now heard about the numbers of Canada's opioid crisis. There is no place on earth other than Canada with a larger problem. But here is one of the faces of those behind these staggering numbers. This is Jack, and her road to addiction, like many, started at the doctor's office.
Jack growing up was a very vivacious young girl, just like everyone else. You know, she loved her Cabbage Patch dolls, and she was a girly girl.
But then at the age of 32, a serious fall down the stairs led to a prescription for OxyContin.
And that was the beginning of her addiction to opiates. It was a prescription given to her legitimately from a doctor.
When the oxy was cut off by the doctor, Jack turned to the streets, heroin and then fentanyl.
The progression from using OxyContin to fentanyl happened within a 6-month frame of time. On January 9th, today's January 9th, on January 9th of 2012, I got the phone call that my daughter was being rushed into surgery to amputate both of her legs because she had contracted flesh-eating disease from injecting in unsanitary conditions. When I arrived at the hospital, they told me that it was already too late. They couldn't amputate because the disease had spread into her internal organs and that they would eventually take her life.
Jack died in August of 2012, one of the thousands of victims of Canada's opiate crisis.
There are no government programs that, you know, help us as parents say, our child is in trouble, it's urgent, and we need urgent care. The wait times for even urgent care are weeks, if not months, delayed. And as a parent, you're sitting there with a child who needs that help right now, today.
My very first speaking engagement was in front of the Toronto Board of Health.
Donna shares Jack's story at conferences.
For far too many years, we all only knew her as an addict.
On Parliament Hill.
I'm fed up with the way people look at me because all I want to talk about is drug policy reform.
At protests.
Because it's become my life's mission.
And for years through this organization she set up called Moms Do, Moms United and mandated to saving the lives of drug users, Donna's been warning everyone from the federal health minister to Mayor Tory about the looming crisis in Toronto.
It doesn't surprise me that John Tory called this meeting today, that happened today. My only question was what took so long. If it was a cancer diagnosis, they would be in hospital and treated immediately. And at least overseen. That doesn't happen with addiction, and addiction is deadlier.
Now, this problem with opioid addiction has spread from the fringes to mainstream. Our colleagues at Maclean's have the story of an ER doctor turned addict.
There came a day when I didn't have any more Percocet, and I knew I was going to go through withdrawal. I had a fentanyl patch that had been given to me, and I cut it in small pieces and I smoked part of it, and I was astounded at how powerful it was. For me, that was the beginning of the end. And that is incredibly frightening.
You can see Daryl Gebbian's full profile online at macleans.ca.